Hi, Dr. Patterson here. And in this video, I'm going to talk about colon cancer being on the rise in younger people. And I'm going to refer to an article that I pulled up on the Yahoo Life by Caitlin, looks like Caitlin Riley, January 19th, 2020. And so in this article, she goes on to give some very good information regarding the incidence of colon cancer and how relevant it is today in younger people contracting it. I mean, it used to be a condition of the age. You know, people in our office would go get their colonoscopies. They were scheduled for it through their PCP. Once they turned 50, 55, maybe 60, if they hadn't had it, they were told about it, certainly by 60, it was definitely recommended that they have it. Okay, so it was a condition that they were screened for, you know, in the midlife, mid ages, 50, 55, 60, 65 for sure. And by that time, if they had seen polyps, which was probably very common, we get a lot of patients who would come back and they found a number of polyps. They were snipped off. They were checked for the pathology. They usually came back benign. And then they were given like a 5-year period of time before they would have to come back and have it rechecked again. We had one person who had 8 polyps, and they were in their early 60s, and they had 8 polyps, which is a lot. None of them were malignant. They were all benign. We put them on a colon therapy program, and when they went back in 5 years, they only had 1. So prevention is the key. So let me ask you this. Is it easier for you to fix cancer or any of these debilitating diseases once you contract it or you've been diagnosed with it, or is it easier to prevent it? And I would say that it's easier to prevent it. It's more difficult to change your lifestyle. That's where prevention comes in, is what makes it so hard, because you're trying to do something that was never done by you, and you're older and you're set in your ways. But the main thing is that you had not realized that food has changed. There's a huge difference in food that, say 70 years ago. 70 years ago when I was born, the food was just packaged. You know, they had just started packaging food. When you bought food that was fresh and it didn't have shelf life, you had a better chance of getting food that contained enzymes. You didn't have to take enzymes. Enzymes were already in the food that was fresh and maybe ripe. Again, they had enzymes, so your digestion was better, flatulence was low. The transit time through the colon was, and I'm going to show you that with our model, was moderate, less, and you didn't get the buildup of waste matter in the body, toxic buildup. But today, this food that you eat, what we call food, is not real food. I mean, it's processed food, and it's only 2 things really wrong with food. Is what you take away from it and sell it, and then you consume it, or is what you add to it to make it something that's not natural or in its natural state, and you sell it and you consume that, or a combination of both. So you fortify it or you enrich it. Excuse me, you don't want to eat food that has that as a processing type of condition. So I want to get into this article, but before I do, let me see if I can turn this around a little bit so that you can see the actual, I want you to see the colon and some of these organs that we're going to discuss here. So this is your transverse colon. This yellow stuff is fat, okay, that's covering the greater omentum, and it should be about that thickness, you know, very small, not out this way, okay? So your transverse colon, this is your ascending colon. So everything starts about right here. Your appendix is down below here, so it doesn't show that, but the appendix is here. This is your small intestine, about 20 feet. Okay, here's your stomach. Underneath the liver here is and this is your gallbladder. You have your stomach. Underneath that is the beginning of your small intestine, called the duodenum. So you got 3 parts of the small intestine. This is about 20, 25 feet long. Small intestine. This is where you digest your carbohydrates, fats, and proteins. Anything that's unwanted will be moved into the large bowel. There's a valve right here called ileocecal valve, which opens and closes based on pressures here to allow undigested food to enter into the large intestine. It's going to move up the ascending colon, across the transverse colon, underneath the splenic flexure, down the descending colon, your sigmoid colon, which is like the J-bend under the sink, okay, and into the rectum and then out. So this whole process takes about 24 hours, consuming just that one meal. The problem that I have seen, and this is where you have problems before I get into the actual article, and because the article states that early detection is key. And that's true to some extent, but it is not going to change the diagnosis that much. Okay, it'll change the treatment, once you're diagnosed, in terms of the amount of time catching early, but you're going to get the same treatment. However, why don't we work at trying to prevent that by eating better quality food, managing the transit time, the time that it takes for the food to enter into your stomach, small intestine being digested into the large bowel for exit. Okay, so in order for that to happen at a timely rate, you have to have food that contains water and fiber. Now, let me just give you an example. There's a huge difference in consuming an apple. Okay, an apple, say an organic apple, you've cleaned it. No herbicides, pesticides, insecticides. And so you take that apple and you eat it. It has water in it. It's close to 90% water. It has fiber, which is what your colon is looking for. Your colon is looking for fiber because there's bacteria in here. You have good bacteria and you have bad bacteria. And the good bacteria is what you need for your immune system. 80% of your immune function is in this colon here. And you also want bacteria to help you, the good bacteria to help you to ward off certain infections and keep the integrity of the colon, meaning that the colon has a lining to it. That lining is covered with mucus, and you want to keep that because that allows the good bacteria to be fed. Now, let's go back to our apple. So you consume this apple, okay? Apple has fiber, it has water. It's going to come right through here, and the fiber is going to feed the good bacteria in here. So when the good bacteria is fed, then the good bacteria will help to protect you. It protects the colon and it protects your immune system. It protects the entire body. It makes sure the cells that are getting the nutrients that they need, and you'll have the proper physiology. Now, there's a difference in processing that apple. You can take the apple and juice it. Now, you get juice, which is the water portion, but little fiber, okay? Now, you can take the apple and extract the juice from it, and you can enrich it with certain things, and now you have apple juice, and you can put it on the shelf in a container. You've enriched it. Or you can fortify it, see? And so when you do that, now it's no longer that apple. So the apple, the quality of the apple is a lot less, but you have what you think is something from the apple that'll give you nutrition. Or you can take the apple juice from the apple and add that to some flour and some sugar and make an apple pie. And so is the apple pie the same thing as the apple? So now you have no water, you have no fiber, but you have something that tastes good, that's hard to move through this colon here. And guess what? The good bacteria is going to starve. And when that good bacteria begins to starve, it's going to eat through that mucus lining. When it eats through that mucus lining, after not being fed for such a long period of time, with a diet like that, that's processed. And we're talking about all the foods that contain high fructose corn syrup, anything that's in a package, things that are in a can, things that you take the water out of by cooking. You're processing this food. When you do that, you're destroying the bacteria in your colon, the good bacteria, which is going to cause an imbalance in here. That imbalance is what caused disease. And so when we talk about colon cancer, which I'll get into in this article in a second, I just want you to understand that this is something that's caused by things that we're doing or not doing. For instance, when you look at the Super Bowl commercials, I like to watch the commercials that relate to food. People are having a good time. You're at a party. And what do they have? They have everything that's there is processed. There's nothing natural. Something natural is not going to sell. Okay. You even have some salad, but you have some salads with the chips, and you have various forms of meats that I've seen. All of that stuff in here, it ruins the diversity of good bacteria in your colon. Now, when you talk about diversity, the bacteria, the good flora, has to have multiple forms of good bacteria. There are like thousands of different types of what we call probiotics. Okay, the probiotics that are in here have to be fed. They have to be fed by certain foods. Foods like onions, garlic, cabbage, Brussels sprouts, beets, asparagus, broccoli. These are the foods that feed the good bacteria, what we call probiotics. And you have to have some certain prebiotics also. So like inulin, that helps. That's a prebiotic. So what we're looking for is a way to reestablish the natural normal flora, because that's where the disease lies. So if you don't have that, if you take an apple and you say, I'm going to have apple pie instead of the apple, or I'm going to have juice from the apple that has additives that gives it shelf life as a preservative or something, not only will it decrease the transit time, allowing the chemicals that cause this transformation from the apple to the juice that sits on the shelf or this in a container in a refrigerator, it's going to change the transit time to where it's going to sit here longer. The longer it sits there, whatever it is fortified with, whatever it is, the additives that are extracted from it. Okay, so these are things that are going to allow for absorption. These are the things that's going to starve your natural, normal bacteria. When that is starved, that bacteria is starved, then it's going to start to eat away at that mucus lining. When it eats away at the mucus lining, then it's going to start to eat away at the colon. And when it eats away at the colon, you're going to have gaps in there. It's going to make these little openings where now this waste matter there was the undigested waste matter from the foods that were in your small intestine that was going to be excreted through the large bowel. Now that stuff enters back into the bloodstream, and your liver has got to refilter this stuff. And this is where your free radicals come from. We know that free radicals, if you're not eating foods that contain all of the vitamins and nutrients that are antioxidants, and that's the antioxidants are in your greens, it's in your fruit and vegetable, then that's how you set up a deranged cell. And when you derange the cells, namely the mitochondria, you set yourself up for cancer. So if you understand what I'm talking about here, we can get into the article, because colon cancer is where all of those 60% of the diseases that are treated today, and they're treatable diseases because they're treatable by food. They're caused by bad food, and so you're going to have to use good food to treat that. All of those disorders that we talk about right here cannot be handled or treated by pharmaceuticals. They can be managed by pharmaceuticals, but they cannot be treated and reverse the condition. And so we're talking about, do you know depression and anxiety come from right down here? Many people who go through depression and anxiety have a poor balance of probiotics and prebiotics in the colon. See, we're talking about depression can cause that. So that's a colon disorder. Autism in children. There's been a lot of debate as to the vaccines for that, for children. I am not going to talk about the vaccines here, but the biggest problem that children have is the infestation of sugar products. Sugar products in the colon, after it's digested, is going to destroy the normal flora. The other thing with children is that whether or not you had a vaginal delivery in terms of the birth or a C-section, you know, when that child comes through the vaginal canal, there's a certain amount of bacteria from the mother that helps because that child is sterile. It doesn't have any bacteria. There's no bacteria in the baby's colon when it comes during birth. So the first instance of bacteria is going to be passing through the birth canal. Then the second and the most notable instance of good bacteria and probiotic to build the colon up, to build the immunity, is going to come through breast milk. See, and there's certain insoluble sugars that we cannot digest, oligosaccharides. These are things that come through mother's milk, and it's for the purpose of that baby and developing the baby's colon. See, developing the immunity, developing the flora in the baby's colon. And this flora is going to change. The mother's flora is going to change all throughout the pregnancy so they can get all of the 1,000, 1,500, 2,000 different types of bacteria that's needed in order to protect that baby and the immune system in the baby. So C-sections, that's going to affect it. So some people are affected at birth. They have a C-section, there's no flora. If they don't breastfeed and they use formula milk, they lower the immunity. So if you went through that as a child, you are behind the 8 ball already. So you got to work very hard at trying to prevent the imbalance that could lead to colon cancer as a result of you not having good flora. So I'm just going to read and go through what the article says. It says colon cancer is on the rise in young people, but colonoscopies aren't routine until age 45. So that's been a little change there. And so they gave some factors that influenced this here. One was age, personal history of colon polyps or cancer. Okay, so that's family history. Inflammatory bowel disease. Well, inflammation comes from, like I say, sugar. You consume excess sugar in your diet. You destroy the natural normal flora. You're going to have colitis. You're going to have some form of inflammation or inflammatory changes that take place because you are affecting the normal flora that should be in the bowel. You don't have any. Family history of colon cancer and hereditary syndrome. Now, hereditary is about 15%. So what about the other 85%? That's diet. They go on to say, or she says, that ethnicity also plays a role with higher rates in certain groups such as American Indian, Alaskan Native population, African Americans, and Ashkenazi Jews. When I look at African Americans, the problem that you're having with these diseases and the numbers that they show, where it seems or appears that you are more prone to disease, is not because you're black. It's not because of your skin color or anything like this, or race. It's because you have not changed with the changes in the food system. The food changed 200 years ago. So you did not keep up with the change because who's going to keep up and find out whether or not, let me go to the store and see if that my great-grandfather, when they farmed and we had to go out in the field and pick an apple or pick some pecans or get a watermelon or get some beans or an onion. You had chickens running around. We don't recommend pork, but you had your own pigs, hogs and what have you, but you knew how to clean them out before slaughter or after slaughter, and you know how to process them and cook them. Do you know that the incidence of cancer was not amongst that group of people? And you think that because if you eat pork from the grocery store, that's the same pork that your great-grandparents raised, or great-great-great-grandparents. Go back 200 years, go back 150 years, go back 100 years. Okay, it is not the same. So it got progressively worse after about 1860. You know, is when things changed. And so instead of you taking food, preparing it on your land, and taking it to town and giving a certain amount of money for your crops, you know, your food, whether it was meats or produce or whatever it may be, now you go to the store, and the store owner and that farm has a connection where someone else is producing the food for you, and they're producing food for a profit, which means that they're giving you food that has to have shelf life, because it cannot be fresh, otherwise it will spoil and they would lose money. So there's a certain economic basis to all of this here. So that's another reason why you're sick. But getting back to African Americans, you did not change with the changes. You did not keep the same formula. So it's hard to live in a city and have the formula that your great-grandparents had. They had land and a farm. You're just not going to be able to do that. So now you have to understand that there's a problem. You're going to have to pay the price. You're going to have to find food that you can readily get that has little shelf life, and it's as close as possible to what your great-great-great-grandparents produced and grew, in order for you not to contract the disease. And so that's what all diseases, and guess what they are? We're talking about obesity. You know, black women did not look like they look today. See, the women are obese, and they're overweight. They have thyroid issues. They have reproductive issues, which are hormonal issues. They have rates of anxiety and depression. As a result, they have poisonings, toxicity issues with hair care products, toxicity issues with makeup. You used to didn't have this stuff before. See, and I remember my mother was saying that if you want to lose a few pounds, all you did was just eat some grapefruit for 3 days, and you lose 3 to 5 pounds. Again, and they were doing it for dress sizes. See, so nowadays, if you take a statin drug, you can't even eat a grapefruit, okay, because it's contraindicated in terms of taking the statin drug for elevated cholesterol. So these are some of the problems that you see. You see Parkinson's disease, depression, anxiety, obesity, hypertension, diabetes, hypercholesterolemia. We see hyperinsulinemia, you know, elevated insulin levels. So if you have sugar in your diet, you're going to have insulin levels. We know that insulin is a fat storage hormone. Okay, so you're going to gain weight through that process of gluconeogenesis, where you're going to make sugar, your liver makes sugar. It's a process by where the body is trying to reduce the amount of sugar, but it is actually overworking your pancreas. And so this hormone is secretion is elevated to an extremely high level. Okay, so but there are complications to elevated insulin. There are complications to elevated blood pressure. So all of this is based on the fact that you microwave your food, see, which destroys the gut bacteria. There are things that you're doing. You have no fiber in the food. You're eating fiberless foods. This is the reason why it's so difficult for you to lose weight, because you go on diets and you don't go on lifestyle. The lifestyle change that you have to make is tremendous, because you have an addiction to the chemicals that keep that food on the shelf. You have an addiction to chemicals to give it taste, because most of the food that you eat tastes really like cardboard. That's what you're eating. If they did not put the sugar in it, you wouldn't eat it. So you have to have the sugar in this food. You have to have certain types of softeners and binders and fillers. Just can you imagine if you didn't have a moisturizer type of chemical in a cupcake, you couldn't swallow it. It would get stuck in your throat. So you need water to help push that down. And then going through the digestive process, you have an extreme amount of acid secretions. So this is going to wear out the stomach lining after a while. So we're looking at reflux disease. You have reflux because now you're deficient in acid. You should have acid when you need it, but you don't have it. And so now you have this problem with belching, and you regurgitate some of the stomach acid. So you have to have antacids to balance it out. But what you're doing is, with a lack of good bacteria, you're destroying the lining of the colon. You cause accumulation of waste matter because your transit time of the waste matter going through this colon is so much slower. It sits there. It's going to erode away the lining. It's going to build up this waste matter. And that stuff that you get back has free radicals in it. These free radicals is going to cause a change in your mitochondria. Your kidneys are going to be overworked. And if you eat meat along with that, which is the reason why I'm trying to get Black people off meat, because your kidneys are different than the kidneys of everybody else in terms of the races. Your EGFR, estimated glomerular filtration rate, is a lot different. So you can't afford to have some of the pollutants, the creatinine. You can't afford to have the ammonia. You can't afford to have a lot of the byproducts of protein metabolism. So I know I'm throwing a lot at you, but these are the things that are happening. Too much protein. You can't digest this protein and process it without damaging your colon and your kidney. And so that's why you see so many dialysis clinics in the African-American neighborhoods. You haven't put it together that you don't see them in other neighborhoods. Are they eating the same foods? Well, some of them are. Some people, you look at a Caucasian, he can process meat quite differently than you can. Do they have colon cancer? Yes, they do. See? Excuse me. But the thing is, it doesn't affect the kidneys like it affects our kidneys. So you have to look at not what everybody else do. It doesn't make a person more superior than the other. It's just that you're in a region, you're eating foods that don't resonate with your physiology. And when you eat foods that don't resonate with your physiology, you'll have pathology. So that's what we have to do. So I think there was a young sister who sent me, had some very good questions. I couldn't answer them on the Instagram. Sister Lena, I hope that answers your question. What can you do? The first thing you can do, you start very slow, and you want to try to reduce the addictive properties of the food that you're eating. So that means this week, instead of eating, say, a package of Oreos, and Oreo cookies are vegan, but the sugar that's in there, and it's not processed, whereas cruelty to animals, but you cannot have that. Okay. So let's cut that down to a half a pack a week. And then the following week, cut it down to a quarter pack, and then cut it down to 2 or 3 cookies that you consume. So in a month's time, you will have eliminated that. So you have to go through the process of reduction and elimination, and then replacing. You have to replace the food. If you're going to cut down or reduce the intake of Oreo cookies, I'm just using that as an example because that might be something that you like, or it could be chocolate, or it could be soda pop, it could be anything. You cut it in half. The first week is going to be hard because you're going to have withdrawal effects from the reduction. So then you got to replace that with something that you had not been eating. A little bit more salad, a little bit more green vegetables. Put some broccoli. Oh, I don't like that. Put some butter on it. I don't like that. But you're gonna be full. You're gonna fill up. Okay. So we start replacing something unnatural with something natural to keep the stomach full, because you're used to a certain feeling of fullness. Okay, which appeases the appetite center. It appeases the hypothalamus, the satiety center. It's a feel-good type of thing that you're going to do. So that's how you do that. And over time, you'll see that you will have replaced all of the processed foods with unprocessed foods. Okay, so I'm going to give you my colon therapy book is not just about colon therapy. It's about foods and the process of eliminating waste matter. And so the whole purpose of colon therapy was to cut down on the amount of time uh, that it took for you to absorb that waste matter. Once it got in here, it sat for so long. And the biggest problem I saw was that this is your stomach right here. The biggest problem I saw was that you was digesting food, you're just eating a meal, but this was all full. This was 24, 25 feet full of carbs, proteins, and fats. And then you did not eliminate the waste from a week ago that's still sitting in here in the colon. So the colon is full, 5 feet, 4 inches, 25 feet of food still trying to digest. You have a meal that you just consumed in the stomach, and it's very possible that you're going to put something in your mouth, a snack or something. So you're full stem to stern. That's one of the main problems that we see. And this is what occurs during holidays, why people have strokes and heart attacks. They are full from stem to stern. See? So you got to clean this out. And the whole purpose of the colonic was to remove the waste matter in here so that what's in here can move in. And hopefully you have enough space where this can, whatever's in here moves in here and moves out. And then what's ever up here moves down in here. You see the process? So that's why fasting, eating one meal a day, that all came about because we wanted to make sure that we have enough time to get that waste matter out, to leave this empty in here and leave this rest and recover. You don't have enough time for the stomach to recover, the small intestine, your duodenum, jejunum, your ileum to recover. You don't have enough time for the colon to rehydrate itself, for the new food that's going to come in before you're filling up your stomach again. You see? So that's the problem. So now I'm looking at this article. Okay, so we got on that, and it said that some factors that can be modified include lifestyle choices, such as smoking. Well, we know smoking used to be, when I come up, smoking a cigarette was the most toxic thing you got. And then, people smoke any and everything today. So there are more toxins in what they smoke. Alcohol consumption was another. There's more things, other things that people drink other than alcohol. A diet high in red meat. So they're telling you to eliminate or reduce the amount of red meat because the red meat is fibrous. It can get stuck in here. It stays in here for a long time. During the process of colon therapy, a colon therapist or a physician like myself that administered colonics was able to see and can tell basically the contents that came through the colon therapy unit. You can tell what a patient's diet is like when you see the consistency of it, the amount of time it takes to administer the procedure, whether they're hydrated or not. So you can tell what the diet is. But when you see a certain undigested particle of food come through and you ask the patient, I can identify what it was. You ask them, when did they have that? You had this yesterday? No, they had it last week. So that means that it's sitting there for a long period of time. So what you want to do is make sure that you have water in your food. So they talk about lifestyle changes. They include red meat. They include being sedentary, along with obesity as the biggest problem. And they recommend that you get the colonoscopy at age 45 rather than wait to, get the colonoscopy at 40 rather than 45 or earlier. And so, some of the signs and symptoms, these are things we've told our patients, years ago. Changes in your bowel habit, persistent diarrhea or constipation. It could be alternating diarrhea and constipation. You want to check that. Rectal bleeding is not always just a hemorrhoid. You see blood in the stool, you have that checked out. Abdominal pain or discomfort or cramps that don't go away. Unintentional weight loss, you're not trying to reduce your calories, or you haven't reduced your calories, you're eating and you're losing weight. Incomplete emptying, you go to the toilet, you have a bowel movement, but you still feel like you need to go. That's a problem. Iron deficiency anemia is another thing. And so we generally see this here with females that are still menstruating. They may suffer with iron deficiency anemia a little bit, or unexplained fatigue. That's another symptom. So this is something that was in that article. And, you know, I'm looking at cancer. We need to have some things that we do in terms of diet that affect the other organs. So if we're talking about the colon here, but you also have liver involvement, you have pancreas involvement, you have kidney involvement. These are things that are generally the effect of eating or consuming processed foods. You might say that Doritos or certain chocolates are healthy for you to eat because they're vegan, but your body cannot process it. And cancer cells, once they get started, the metabolism is shifted for these cells to start to feed and grow instead of your cells and your natural normal cells. Now they want to grow. Then that Dorito and that chocolate is going to feed the cancer. The sugar, it's going to be the main thing that's going to make these cells divide, and they're going to divide rapidly. See, and so you've got to be able to make sure that you protect your colon, your kidneys. Let me just start taking some of the stuff because I want you to see this here, because this is where blacks have a huge problem. We have some major issues back here. Let me see this stuff. Okay, so this is your stomach. You see where it is, mainly on that left side at the top here. All right, so I'm going to take this out, and we're going to take the colon out a little bit right here. These are your kidneys, okay? And these are the adrenal glands on top. So a lot of your stress hormones are secreted whenever you get stressed out, but you burn these glands out, okay? You can start gaining weight and put yourself into a diabetic situation just because you have burned out adrenal glands. And so this is another reason why blacks need to get rid of meat. You can't process the meat. Like I said, the ammonia, sulfur, a lot of the byproducts, creatinine, a lot of the byproducts will help to accelerate destruction of your kidneys, and it will affect your EGFR rates to where you may need to replace this here. We don't want to go through that part. But then you also have to deal with stress. But the main thing that helps to combat that is making sure that your colon is working properly, and that you have really good bacteria in your gut. That gut bacteria is extremely important. You want to make sure that you have a proper working gut and your diet. And the main organ of detoxification is going to be your liver. This liver has got to function. You got 3 different types of fat. You got this type of fat. You got the visceral fat. The visceral fat is the most dangerous fat. That's the fat that get around your liver. We talked about non-alcoholic fatty liver disease. We're seeing that in children right now. That's because of the soda pops, the candies, the cookies, the chips, the hot dogs and hamburger type diet. It's going to affect them a little later in the colon, but you get liver problems, cirrhosis of the liver, fatty liver. Now, subcutaneous fat, black women have the most subcutaneous fat. That's the fat that's in the butt. Okay, it might look good when you're young, but when you get older, that fat is supposed to protect you. It's supposed to be a reserve. It's going to harm you later on in life. And so that's where your exercise come in, and making sure that you have good, proper bowel habits, making sure that your liver is detoxifying itself, making sure that your lungs detox. The lungs detox too. So make sure that you have proper respiration. So these are some of the things that I hope that will help you why your diet is most important. Like I say, 70% of all these diseases that you're taking medication for is for improper diet, affecting the stomach, the liver, your gallbladder, your pancreas, your colon, your small intestine, affecting the fat. Like I said, that visceral fat around these organs. You can get visceral fat around the heart. We see fat around the heart, the liver. That's dangerous fat. You have to get rid of that. Okay, and all of this stuff that we talked about everything here is really a result of a poor diet, nutrition deficient diet. You're getting no nutrition. So you're basically starving, and you're in starvation mode, and then you're tired. So you're going through exhaustion. These are things I say they kill you. You die from starvation, exhaustion, and exposure. You're exposed to these toxins in the food. You're exhausted and tired because the mitochondria are not replacing themselves, or they're not working properly, and the body is starving. So this is the reason why I'm saying that it's vitally important for you to get rid of red meat. Blacks definitely need to get rid of red meat. Okay, and you'll see the numbers will start to turn around as you begin to turn around your dietary habits, first of all. That includes your environment, increasing your water, increasing the water that's in your food, reducing and eliminating food that's processed, anything that's in a box. If you can't pick it, can you go out and pick mac and cheese? Where do you find that in nature? And that's one of the foods that we really love, but you want to see what it does to your heart and your blood vessels, your arteries and whatnot. You need to start taking classes to show you this kind of stuff here, show you the pathology. So I'm not going to continue telling you what not to eat. We're in a position right now where we're just picking up the pieces, but I shouldn't have to be picking up the pieces after 41 years of working with patients who came in where the biggest problem that we had back years ago was dietary, and it's become an even bigger problem, and the problem is growing. So you're going to have major issues because the hospitals are changing. They're starting to eliminate the existence of nursing homes where you're going to have to take care of yourself at home. You'll be forced to do it. So what better time than now? So I hope this was a good lesson for you. You got some information that was key to helping you make some decisions, because all you have to do is get started. You just need a little push. I'm here to give you that little push that you need. You don't have to start with fasting. It's going to be difficult for a person to go into a 21-day or 27-day fast in this condition. Okay, so you start with just reducing the foods, and you want to do something a little bit more challenging but very beneficial. We have those 10-day programs. Blood sugar, if you're more prone to diabetes or insulin resistant problems, you need the 10-day blood sugar program. If you have problems with the inflammatory problems that result as eating foods that are high in omega-6 and not in omega-3s, you will need to have the 10-day inflammation program. If you want to go even further than that, there's a 21-day program, and all these programs have just rearranged foods for you, made them a little bit more easier to digest, to keep you full, because that's what you're used to, is a full feeling, but they're much more nutritious. They run the processes in the body, the physiological and metabolic processes in the body. You have supplements that go along with that. After about that second or third day, you no longer have cravings for food. So this is something that you ought to embark upon, because it's affecting each and every one of us. You have family members who will drop dead or have dropped dead from overeating, eating too much, too often of the wrong foods. Okay, so I hope this helped, and get in contact with us if you want to pursue this a little bit further. These are things that you can do at home for yourself. You don't have to always see a doctor. You have most of the information yourself. Let me show you how to use that information and turn it into a plus instead of a minus for you. Okay, best in health.